Hi, I'm Julie Metzner, and this is my submission for my gender and sex in medicine assignment. So just to get started, I just want to talk about what is the difference between gender and sex. So sex is what you're born with. When you're born, you most likely have female or male genitalia, and then your chromosomes and your DNA kind of go along with that. So if you were born with female genitalia, you're most likely going to have XX chromosomes. And if you were born with male genitalia, then you're going to have XY chromosomes. And that tells biologically what sex you are. Most people will identify, their gender will go along with the sex they were born with. But that's not true of everybody. Gender kind of tells what you see yourself as, your role, and how you behave and where you fit in the world. And there are people who may have been born one sex but identify as the opposite gender. And we are seeing that more and more in medicine today. And we need to know how to be sensitive and careful with those patients so as not to offend them and hurt them and have them feel ostracized. We want those patients to still feel honored and taken care of and special. The interaction between a doctor and a patient. The first part of the video I'm going to show is how things can go wrong and how maybe we should not act with our patients. And then at the end, I'm going to show a way in which we should interact with our patients. My target audience for this would be my respiratory therapy department, respiratory therapists, and other nurses and caregivers who might come across transgender patients. So let's get started. This is Sylvia. Sylvia is a female unicorn. However, was born as a male horse. And she has come into the urgent care to see the doctor about some abdominal pain that she's having today. And Dr. Princess is about to come in and see her. This is Dr. Princess. Dr. Princess is having a very busy day today. It's been rough. She's feeling really stressed out. Hi, I'm Dr. Princess. What's happening today? Hi, I'm Sylvia. I'm having some abdominal pain. Okay, well, what kind of abdominal pain? What's going on? Where is it? How long ago did it start? I need to know. About 3 days ago, my stomach hurts, and it really hurts low in my stomach, and it's hard for me to go to the bathroom. Okay. Well, I need to just examine you. I'm a little uncomfortable with that. You seem really rushed, and I'm a little nervous. Well, I don't know what you'd be nervous about. I'm a doctor. Yeah, you should just let me examine you. Well, I'm scared. There is nothing to be scared about. I'm a doctor. Let me examine you. Let's get to the bottom of this. Well, okay, I'm in a lot of pain, so I guess so. What happened? You have female unicorn, not a male horse. What's happening? I feel uncomfortable. I need you to leave. I don't like how you're treating me. What are you talking about? I'm a doctor. You are not treating me with respect and dignity, and you need to leave the room. Goodbye. So yes, clearly didn't go well. That is what not to do. Don't do that. Now, that is wrong on so many levels. The rushing, clearly the doctor didn't look at the chart, didn't know the patient, wasn't comforting the patient, and was being completely disrespectful of the patient's gender. Let's do that again. I'm looking at the chart. Okay, all right, great. Good morning. I'm Dr. Princess. Are you Sylvia the unicorn? Yes, I am. Well, it's nice to meet you. I looked at your chart and I understand that you're having some abdominal pain. How long has it been going on for? Well, doctor, it has been going on for 3 days, urine, and they did an initial test, and it doesn't look like you have a urinary tract infection. So I'm going to need to examine you a little bit more extensively and maybe even do some more testing. Okay. I understand that you're a little nervous. It can be scary to be examined, and I just want to put you at ease. I read your chart, and I know that biologically, when you were born, you were a male horse. But you are Sylvia, the female unicorn now. Yes, yes, I am. So I have to examine you because in biological males, you things that females don't have. For example, you still have a penis and a testicles and a prostate. And in females, in biological females, I would be maybe looking at ovaries and the uterus. And since you don't have those biologically, I just need to examine you and make sure that I am treating the right problem. I know that you are a female unicorn, and I honor that, and I would never want to make you feel uncomfortable. But I just want to explain to you why I need to examine you in the way I do so that this wonderful life. Oh, doctor, I'm so glad you said all that. I feel so much better. I appreciate everything that you're saying to me, and I feel so comfortable with you. What kinds of tests do you think you're going to need to do? Well, I'm going to do a physical examination and check everything out and make sure nothing weird is going on there. After that, if I don't find anything like that, then I might do an ultrasound and maybe even an x-ray. Okay, doctor, I'm on board with that plan. Second scenario, much better. Happier patient, happier doctor. Besides the fact that the doctor was calm, cool, and had reviewed the chart ahead of time and knew everything going in, it was a much smoother encounter, much more respectful to the patient. This is how we should treat our patients. I hope you have a great day. Thank you.